Sciatica is a common condition which occurs when the sciatic nerve becomes pinched, compressed, or irritated, most commonly in the lower back. In this video I will discuss the most common cause of sciatica, which is from a disc bulge or herniation. Other major causes of sciatica, such as spinal stenosis or compression or entrapment of the sciatic nerve by the surrounding muscles, will be covered in separate videos. The spine consists of a series of block-like bones stacked together, and between each of these bones is the intervertebral disc. Each of these discs consists of an inner part containing a jelly-like substance known as the nucleus, and an outer part which is made up of a series of thin ligamentous layers that wrap around the nucleus. To conceptualize this, think of a water balloon whose liquid center is contained by the rubbery outer layer of the balloon. With the spine in an upright position, gravity pushes the bones of the spine together. This compressive motion acts to increase the pressure in the disc and squeezes the jelly-like nucleus outward from the center towards the periphery. To use an analogy, this is the same thing that happens when you squeeze a water balloon between your hands, causing the pressure to increase within the balloon. Now, under normal circumstances, this outward pressure is absorbed by the rubbery outer layer of the balloon, or in the case of the spine, by the outer ligamentous layers of the disc. This ensures that the jelly-like nucleus remains in the center of the disc. However, if the disc becomes damaged, it will not only be able to properly counteract the increased disc pressure, but will also be unable to contain the jelly-like nucleus in the center of the disc. Instead, the damaged part of the disc will actually start to bulge or herniate outwards. This will not only be a source of back pain because of the damage to the disc itself, but as the disc herniates, it will start to pinch or compress the nerve roots in the spinal foramen behind the disc. This is what leads to damage and inflammation of the nerve, which is what is responsible for the pain and neurologic symptoms such as burning, numbness, or muscle weakness into the leg. Fortunately, very few sciatica cases require surgery, with most patients responding well and often quickly to conservative treatment. However, given the pain and potential for long-term and even permanent neurological deficits, these conditions do need to be diagnosed and managed properly. The first priority in treating these cases is to reduce the pressure on the damaged disc and compressed nerve root so they can start to heal and get the patient's pain under control. This usually requires a combination of specific in-office treatment along with special home-based exercises to stimulate the healing of the disc and the nerve. In our office, we use a treatment method known as Cox flexion distraction. We have published other videos and articles that demonstrate this technique in detail, but for the sake of continuity, I will provide a brief description here as well. Cox treatment uses a specially engineered table that gently pulls and stretches the spine. With the patient lying on the table, the lower section of the table can be slowly pulled down and away. This motion lengthens the spine, which pulls the bones of the spine away from each other in order to decompress or stretch the damaged disc. Unlike other traction or decompression therapies, this treatment allows us to focus the stretching and decompressive effect at the specific areas of the spine that are damaged. Not only does this open the joints of the spine and take pressure off of the pinched and compressed nerve roots, but this procedure also reduces pressure within the intervertebral disc itself, reducing strain and stimulating healing of the damaged disc. In addition to using Cox technique, we also prescribe specific exercises to help manage pain and stimulate healing of both the nerve and the disc. These exercises are a critical part of treatment, as the patient can do them several times a day as opposed to only receiving in-office treatment a few times a week. We have found that by combining Cox treatment with these home-based disc and nerve exercises, we're able to help most people get out of pain and get back doing the things they want and need to do, often with dramatic improvement coming in just a few weeks of care.